This is a very difficult question, and I think I cannot highlight one thing. It's a very dense congress. It is the largest congress in hepatology worldwide. So you have here all the important results are presented here. And so you have effectively many new results of studies, experimental work, which is presented here. So it's very exciting. So I cannot say, oh, there's this, which is really the best things. Difficult to choose where to go because effectively there are many sessions in parallels now. I remember the Congress when it was not the case and you can go in one room and you see the whole Congress. So now it really changed a lot. But I'm going by interest, I'm looking what I would like to know, what I would like not to miss. And so mostly since I'm interested in hepatocellular carcinoma and in non-alcoholic steatohepatitis, I'm looking for this. But obviously, since I'm also seeing patients with all kinds of liver diseases, I'm going also to other sessions to see other results, other new developments which are important. But for this, and I think it's important to mention that, you have the liver tree. So if you miss important sessions, you can, from home, at home, sit and look at the sessions that you could not attend and very calmly look at them and enjoy them. So I was extremely lucky because I was twice on the governing board. I was first as a scientific member for 3 years, and then 5 years later I came back as educational counselor. So I had really the opportunity to work in the governing board for many years. So the governing board is actually designing completely the Congress, meaning that you decide how you want to organize it, but you also have a very interesting but also very responsible sessions when you will design the scientific program, because we will receive a lot of excellent abstracts, and so you have to select the one and to try to build a program which is attractive and you really highlight the best one at the general session. The ILC has a huge impact on the clinical level. I mean, people change the way they are working in daily practice based on things they have seen here. There's also a very important development in ILC is that now we have good clinical practice guidelines on many topics. And so you have recommendations how to manage a patient, how to treat a patient, and they are presented here also. So yes, the ILC has an impact on the daily practice of physicians dealing with liver diseases. I mean, teaching is one of the important roles for everyone involved in academy. It's not only to go beyond the actual knowledge, but it's also to transmit this knowledge and transmit also the desire of younger individuals to enter the field and to also produce interesting data. So ILC and actually EASL has been always excellent at attracting young investigators, and there is a whole part of the program for them. They have a place which is reserved for them. They have a young investigator party on the Thursday evening, and they are also invited to come here. They have benefits also to come here, and I think they meet here. They can have a network. And there's also a new meeting organized by EASL. This is this masterclass when the young investigators can meet and discuss between them and learn also how to present and discuss results. For me, it's a great opportunity to meet a lot of friends, to catch up also with science in field where I'm not always following what's happening. It's also a good opportunity also to meet new person, to establish contact for future studies, collaborations. So there's a whole social aspect on top of all the scientific aspect. I think the take-home message for me personally is that this meeting is continuing to grow, because we grew a lot, and we're thinking, until when? And we are still growing. It's fantastic. And there are so many young persons at this meeting. So the hepatology is a very exciting place to be. Everybody said, it will be much less important because now we are treating hepatitis C. First, yes, we are curing hep C, but it will not disappear. And we have many other diseases, and we have many patients who need to be treated. So great to see that the meeting is continuing to grow. I think if you want to profit for the ILC, obviously it's very dense and you have in few days many things. So it's before to come here, to look at the program obviously and to organize and to see where you want to go and prioritize. And obviously if you want to meet people, also to contact them before to try to find time to sit down and to discuss. But you also to be open to new possibilities, and so it's a compromise between being too Swiss and too organized, and so we're open to a little bit of chaos.